Yeah. If we talk about this particular study that was conducted by Chapman and Delapp, what is the study about? This study has to do with 9 sessions being used to treat individuals with blood injection injury phobia with manualized cognitive behavioral therapy. And this was conducted on a single individual who was an adult. And if you're conducting a research on a single individual, you might as well refer to this as a case study because the single individual was a male. It wouldn't be wrong to refer to this research as an endocentric research. Now, taking this further, we would continue what we have been doing earlier. We would initially discuss the context, the main context, then we'd move on towards the main theories and explanation, followed by the aim, followed by the study design and results towards the end. So, without any further ado, let's begin with the context of this particular research. As we speak about the context of this particular research, this research has to do with cognitive behavioral therapy along with applied tension being used. Now, what is cognitive behavioral therapy and what is applied tension? When we use the word cognitive behavioral therapy, also referred to as CBT, is number one, very widely used. Number two, it is seen by many as a very effective treatment for anxiety and fear related disorders. Now, how does this work? As the name suggests, cognitive behavioral therapy. So, you help an individual identify the maladaptive, the distorted cognitions or the thought that a particular individual has. And then, after you're done helping the individual identify those distorted thoughts, you would help that particular individual replace them or change them or alter them with a more logical or a rational thought. So this particular method, that is CBT, it focuses on identifying and changing unhelpful thoughts, or in this case, like I was saying, irrational or illogical thoughts or patterns of behavior that might as well be contributing towards that anxious behavior, towards anxiety. So, cognitive behavioral therapy is a widely recognized and an effective treatment for specific phobias, including blood injection injury phobia, that is BII. Remember, the idea over here is you help the individual. Okay, now the idea over here is that you help the individual identify his or her irrational thoughts so that you could again help them challenge those thoughts and replace them with something that is more logical, more reasonable, more rational, so that you could help them not feel anxious. So, about blood injection injury phobia, this is, as discussed earlier as well, this is that particular type of phobia that leads to, I mean, the chances of individuals fainting because of blood injection injury phobia are relatively a lot higher, a lot more as compared to any other phobia. And when I say the chances of you fainting are higher, that means there's a physiological response to this as well, a physiological response. And if I may add up to this, when we talk about blood injection injury phobia, not only are you trying to help the individual reduce that fearful response, but at the same time you would want to help that particular individual reduce the physiological response to it as well. So not only are you trying to help the individual with the fear that an individual encounters, along with that fear, you want to help that individual get over with the physiological negative response to this as well, and which in this context, in this case, is referring to the act of fainting. So BII, that is blood injection injury phobia, is unique because it is associated not only with intense fear but also with the physiological response involving fainting due to lowered blood pressure. We've spoken about this in detail in our class before. So therefore, treatment require more than just reducing fear. It also involves managing the physiological response too. Now, like I had said earlier, this particular study, when we talk about this particular study, this has CBT along with applied tension being used. At the beginning of our lesson today, I had tried explaining you what applied tension was. And when we talk about applied tension, remember, you try to teach or you try to train a particular individual to apply tension to apply tension to muscles. And the logic over here is that this application of This application of tension to particular muscles would help an individual from fainting or would keep an individual away from fainting. So, this is a technique where you deliberately tense an individual's muscles. So, the individual does it himself or herself. So, the individual is trained to deliberately tense his or her muscles to increase blood pressure, which you do so that you could prevent that particular individual from fainting. So, taking this ahead, if we talk about the main theories and explanations, or in other words, as we refer to this as the psychology being investigated over here, along with CBT, this also involves applied tension. Applied tension is a behavioral technique used to treat blood injection injury phobia, which involves teaching individuals to apply muscle tension to increase blood pressure and prevent fainting when exposed to phobic stimulus. So the logic is teach them to tense their muscles so that you could help them from not having a lowered blood pressure, which would again consequently help them from not fainting. If we talk about the aim of the study was to investigate whether blood injection injury phobia could be successfully treated using a combination of both CBT and applied tension techniques. That was pretty simple here. If we move on towards the sample is a single individual who is a male, and we're referring to this individual as T. And of course, if we're referring to this individual with T, we're maintaining or we trying to maintain the ethical guideline of confidentiality over here. This is a single individual, and because this is a single individual, we would refer to this particular research we would refer to this particular research as a case study. And when we refer to this particular research as a case study, all the pros and the cons associated to case study should be kept in mind. Of course, if it's a case study, this would be unique to that particular individual, which would, I mean, it would only be just one individual, which would again help you with gathering a lot of detailed information. But at the same time, there are certain flaws or drawbacks or weaknesses or limitations to this as well. Because if you're collecting information or data from a single individual, the likelihood of you being able to apply those findings or the results on the wider population might reduce, which again makes the research lack generalization or lack external validity, as you may refer to it as. So this was a case study of an individual referred to as T. T was a 42-year-old white male diagnosed with BII phobia, that is blood injection injury phobia. T was also diagnosed with a major depressive disorder, which was reoccurrent and, however, in full remission based on an episode during his college years. So, this is a study on a single individual with the name T. He was 42 years old, he was white, he was male, making this research and endocentric research. This individual was diagnosed not only with blood injection injury phobia, but this individual was again going through a remission period for a depressive disorder that this gentleman had during his college days. How is it that the data was collected? Data in this particular study was collected through self-report measures, primarily through interviews and questionnaires. When we talk about interviews and questionnaires, they're both examples of self-report measures. And bear this thing in mind, when you're collecting data through self-report measures, you can never be sure or certain about the extent to which you can rely on those findings, because whatever the information is that you've received, whatever the data is that you've received, you've simply reduced it from that particular participant, or in this case, that particular patient. Now, data was collected initially through Beck anxiety inventory. Now, this Beck anxiety inventory uses Beck anxiety inventory to be able to measure the anxiety levels of individuals, then followed by Beck depression inventory. This is used, as the name suggests, to measure depressive symptoms. This BDI has been taught to you when we were studying mood disorders. Number three, the quality of life satisfaction questionnaire, which is referred to as QLESQ hyphenated. This is typically used to assess general satisfaction across various areas of life. Number four, blood injection symptom scale, that is BISS, and this is used to assess specific symptoms related to BII phobia. Now, when we talk about BAI, that is the first one, Beck invent. Okay, now you do not need to know a lot more detail. You do not need to know more than this, but just in case if you're interested, BAI, just like the BDI, is a self-report measure. It has 21 items. But what makes the BAI different from BDI is BAI assess your anxiety symptoms, whereas BDI assesses your symptoms for depression. Symptoms that have to do with anxiety, that is BAI, that is Beck Anxiety Inventory, might have to do with sweating, trembling. These are physical, or rather say physiological symptoms. Cognitive symptoms might include the fear of losing control. Again, just like the BDI, this particular scale, or this particular inventory, this particular psychometric measure uses a rating scale. And I think that's more than enough. If we move on towards the BDI, I'm sure you all do have an idea about the BDI, the Beck's Depression Inventory, a 21 item self report measure. Moving on to the third one, we have the quality of life satisfaction questionnaire over here. Like this says, this quality of life satisfaction questionnaire is used to assess an individual's satisfaction, the level of satisfaction and enjoyment in various aspects of life, as this suggests. Now, what would these various aspects of life be? They could they might have to do with your health, your work, your social relationships, or in a nutshell, your overall well-being. Again, the fourth one, that is blood injection symptom scale, which is also referred to as the BISS. This specific scale is used to assess your symptoms related to BII phobia. So this is a specific scale that is used to assess the intensity and maybe the frequency that is associated with BII phobia. I mean, this might have to do with fainting, feeling nauseous, or experiencing fear when you are exposed to anything that has to do with blood, any blood related stimuli, or it could be any needle too. So yeah, data was collected primarily through interviews and questionnaires. We just spoke about a couple of questionnaires over here. If we move on towards the procedure, now, as we speak about the procedure, T, that is the participant, in this case, the patient, went through 9 different sessions of CBT and applied muscle tension. He was educated about the prevalence of phobias, created a fear hierarchy, and used the subjective unit of discomfort scale. Let's go step by step. Number one, we need to know there were 9 sessions, right? Number two, we need to know that these 9 sessions had to do with CBT applied, CBT along with applied tension. Now, when I talk about CBT over here, remember the idea is to help an individual identify their distorted thoughts. So, of course, to be able to help the individual identify their distorted thoughts, you'd have to educate them first, right? You'd have to make them familiar with the cognitive behavioral therapy. For you to be able to make them familiar with the cognitive behavioral therapy, you'd have to make them familiar with the cognitive explanation that helps us understand why individuals develop phobias in the first place. So he was educated about the prevalence of phobia. Number two, created a fear hierarchy. And we've spoken about this fear hierarchy a couple of minutes ago. Number three, there was a subjective unit of discomfort scale that was used to rate this particular individual's level of anxiety. Now, when I talk about this subjective unit of discomfort scale, also referred to as SUDS, this is a self-report scale ranging from 0, that is having no distress at all, to 100, that is experiencing extreme distress, no distress to extreme distress. This particular scale, that is SUDS, is used to measure the intensity of subjective emotional or physical discomfort during exposure to anxiety provoking situation. In this case, that is blood injection and injury, right? So it could be blood and injection or an injury. So the extent to which you, and this is of course subjective, because I mean, it's you, the patient. I mean, what one patient might be going through might be different from what another patient goes through. So the physical, this has to do with measuring the intensity, right? You're trying to measure the intensity of emotional, or this could be physical as well, discomfort that you encounter when you're exposed to any anxiety provoking situation, right? So if you're exposed to any anxiety provoking situation, and that in this case was blood injection and injury, the level of discomfort that you'd encounter. Again, like I said, there was a rating scale over here where 0 meant no distress and 100 meant extreme distress. Moving on, if we quickly hop on to the results of this particular study, If we talk about, so the results, I'd like to divide this into three different categories over here: category one, category two, and category three. If we talk about the results here, number one, before the treatment, right? So the SUDS was used before the treatment as well. So the participant T, that is the patient T, reported severe anxiety related to blood and injection. One, anxiety was severe. Number two, there was minimal depressive symptoms, and overall, the individual had good health in most areas of life. He experienced intense fear and anxiety when exposed to medical procedures. Number two, if we talk about how the patient felt during the treatment. T, that is the participant, that is the patient in this case, successfully worked through each stage of his fear hierarchy with his SUDS. Now, ask yourself, do you still remember what SUDS is? SUDS is your subjective unit of discomfort scale. That looks a little untidy, more than a little, but I think that would make do. So T successfully walked through each stage of his fear hierarchy with his SUDS ratings gradually decreasing at each stage. The final stage involved T having blood drawn, which initially produced a SUDS rating of 40 out of 100, but soon dropped to nothing. So it apparently looks like the CBT along with applied tension technique worked out really well for this particular gentleman T. So the final stage involved T having blood drawn, which initially produced a SUDS rating of 40 out of 100, but soon dropped to nothing. Only minimal applied tension was needed, though. If we talk about a free follow-up that was taken after 4 months, 10 months, and 12 months post-treatment, T reported attending several medical appointments without experiencing any significant anxiety or fear. Of course, if an individual is scared of medical procedures, if an individual is scared of needles, uh, injections, or what is the other one? Blood, the individual might end up showing reluctance towards medical appointments, which could have not good consequences at all. I mean, if you're ill, you need to go see a specialist. If you're ill, you need to go see a doctor. If you're showing reluctance and if you get anxious when it comes to medical appointments, that in other words means you would not be able to be treated. So the follow-up at 4, 10, and 12 months post-treatment, T reported attending several medical appointments without experiencing any significant anxiety or fear. So that's a win-win situation here. He no longer met the criteria for BII phobia and reported feeling significantly better. So overall, this gentleman felt significantly, not a little better. And this gentleman no longer met the criteria for blood injection injury phobia. Concluding this real quick, if we move on towards the conclusion here, the study demonstrated the successful treatment of blood injection injury phobia using cognitive behavioral therapy along with applied muscle tension. T, that is the participant, that is the patient here, was able to engage in medical procedures without experiencing fainting or significant anxiety. And the results were maintained for at least 12 months. I hope why is it that we say 12 months? We say 12 months because of this. Now, if we move on towards the strengths and weaknesses of this particular study, since this was a case study, of course, the information that you've received was in detail. The information you received was specific to the experiences Mr. T had, and and this provided a very detailed understanding of his symptoms and treatment process. Because there were multiple methods that were used, the researchers could have a comprehensive analysis of T's progress. The weaknesses here, because this was a case study, there was a single individual that was being studied. And of course, this puts the findings in a very compromising position because the finding cannot really be applied on the wider population, which of course limits the external validity of the study as well, also referred to as generalizability. The reliability of the study, as we are aware, as we should be aware, as we've studied in our AS, case studies are not easy to be replicated. If you cannot easily replicate them, you might not be very sure about the reliability of the findings, which is again a flaw, a drawback, a weakness, a limitation. The last one, self-report bias, the use of self-report biasness, of course, uh, you were using questionnaires and interviews. And if you talk about using self-report measures, you can never be sure or certain about the information you've received. You can never be certain that the information you've received is actually based on truth and honesty. And yeah, so the accuracy can be questioned as well, and the likelihood of individuals wanting to give socially desirable answer is always there. Why socially desirable answers? Because like you had studied when we did Saved and Silverman in AS. You can never be sure. Let's just say this gentleman T, because of the fact that he was aware that he was being treated, he might be simply wanting to give into the situation to make the therapist feel like it actually was working. So again, these could be a few limitations that could affect the credibility of this particular research. Moving on towards the application here. So BII phobia is dangerous because the chances of individuals fainting over here are relatively higher as compared to other procedures. And fainting is dangerous, and it might cause a lot of embarrassment to the patient as well, because of which many patients might end up avoiding any sort of medical procedures, uh, which might lead to them having to compromise in their on their health. So effective treatments of this sort in nature can improve quality of life and ensure that individuals receive necessary medical care. I hope this was helpful. Stay amazing. Allah Hafiz.